goes red, you're live. Ready? You're live.
Oh, hello guys. Welcome to Dr. Gilead Show. Today is Thursday, July 6th, 2017. Today we're talking about dementia, vascular dementia that could arise from high blood pressure. So today is a very, a very important topic. I want everybody to tune in. It's Dr. Gilead Show. We are on Facebook Live. We are also on WBGR Radio. You can call on 301-429-9247, 301-429-9247. We are on Dr. Gilead Show. Today we're talking about vascular dementia. That is dementia that arises from blood pressure problems or vascular problems. Before we start, usually, we talk about the need for you to please do not make a diagnosis on yourself based on what you hear on this platform. Do not treat yourself based on what you hear on this platform. It's always good to consult a doctor and get the appropriate diagnosis so that you can get the proper treatment. Dr. Gilead Show, the producers and the host, cannot be held responsible for what anybody does based on what they hear on this platform. So please do the best you can to get the right diagnosis from a trained personnel. Vascular dementia. The dementia is, simply put, a decline in our thinking skills and in ability to remember things. Vascular dementia is a decline in the ability to remember things that happened in the past, or even immediate things that happened in the few minutes ago, a few hours ago, a few days ago. These could be caused by conditions that block or reduce blood supply or flow to the brain, or specifically part of the brain. When this block happens, when there's a block to a supply of blood to a particular part of the brain, what happens is that the brain is deprived of vital oxygen that we need, as well as the nutrients. These are the oxygen and the nutrients are carried to the brain by the blood. So once there is an obstruction, then there is a problem. Oxygen and the necessary nutrients will not get to the brain. And what happens is the brain will have a problem. If this continues, the particular part of the brain that is deprived of oxygen and nutrients will eventually die. The cells, there will be cell death. The brain has one of the richest blood supply. The network of blood supply to the brain is rich, but also the brain is very vulnerable when the blood supply is reduced or completely blocked. Vascular dementia is the most common cause of dementia in older people. It is estimated that 15% to 20% of dementias in older people are caused by vascular dementia. So if you take a cohort of 100 people with dementia aged above 65 years, 20%, 15 to 20% of those will be caused by vascular dementia. Now, question is, what are the causes of vascular dementia? Like I said before, vascular dementia is caused when blood supply to the brain becomes blocked or narrowed. So this is the commonest thing that happens in strokes, especially the type of stroke that is caused by an emboli or an embolus blocking the blood vessel to that particular part of the brain. So when this happens, the blood carrying oxygen to the brain is suddenly cut off, and the person will have a stroke. Now, this can lead to dementia, but not all people with strokes have dementia. Vascular dementia occurs very slowly over time as minor silent strokes. That means tiny blood vessels coming to the brain are blocked slowly, and the tiny areas that are supplied will slowly die. And because it happens so slowly and in tiny areas, there may be no major physical symptoms. A lot of the times when a physical or cognitive disability is noticed, then it is already too late. And that is why vascular dementia is possibly preventable, and it just needs for the individual and family members to help out here. And that is the main reason why today I am talking about this particular type of dementia. We've talked about dementia in the past, where I had a colleague of mine, Professor Reginald, come talk about Alzheimer's dementia. But today, this type of dementia I want to talk about is the type that is preventable, and if we pay very good attention, we may be able to prevent this in family members or even in ourselves. Now, what is the prevalence? How common is vascular dementia? We know that is the second most common cause of dementias after Alzheimer's dementia. Alzheimer's dementia is the most common, followed by vascular dementia. Dementia caused by obstruction in blood vessels to the brain. In the U.S., vascular dementia ranges from 0.2% in the people aged 65 to 70 years old, and as they approach 80 years, it gets to 16%. So it ranges from 0.2% for those who are below 70 to 16% once you hit about age 80 and above. So which means the older we get, the higher the chances of our having vascular dementia. That is one of the problems here. It's also known that 20 to 30% of strokes are diagnosed with dementia within 3 months after suffering the stroke. So 20 to 30% of people who have stroke would be diagnosed with vascular dementia within 3 months after the stroke happens. Vascular dementia, we know, is more common in males than in females. And it's also known that vascular dementia is more common in African Americans than in Caucasians. And it's known possibly because the African Americans will suffer more from high blood pressure and all the other medical problems that will predispose to stroke. So quickly, let's look at the symptoms of vascular dementia. Now, the symptoms that could be produced from vascular dementia and the severity depends on the part of the brain that is affected. Remember, we said vascular dementia, you have blood supply to a particular part of the brain cut off. So the symptoms we will have depends on what part of the brain is affected by the disruption of blood supply. The commonest symptom is memory loss. Memory loss, and this is depending on the part of the brain that is affected. Short-term memory is more problematic in people with with vascular dementia compared to Alzheimer's dementia. So people with vascular dementia may not remember what they ate this morning, but they may remember what they did 10 years ago. While in Alzheimer's dementia, the reverse is the case. Also, people with vascular dementia may get easily lost, because what happens is they get out of their house, they go to the bus stop, or they go to somewhere to buy something in a store next door, they forget how they got there. Short-term memory problem. They cannot remember how they went back. So because they can't find their way back, they wander around. And that's why wandering around is another common symptom, because they cannot find their way back to where they started from, or back to their hotel room, or back to their house. And sometimes they get lost if they can't find their way, and if a good neighbor finds them, or the police, then they're taken home. That is a very common symptom. Sometimes they have inappropriate behavior, like they may just cry for no reason or laugh for no reason. So they have inappropriate laughter or inappropriate crying. It doesn't make sense. So, but these all depend on the part of the brain that the blood supply is affected. Other problems, other symptoms of vascular dementia is difficulty with focus, difficulty with concentration. They have difficulty concentrating. They also have difficulty planning and following through with activities. So they plan on what they want to do, but to follow through is difficult. They cannot concentrate enough to plan the activities. They also have difficulty managing their money. That is very common. They have difficulty managing money, and that is a major problem in their life activity. People with vascular dementia also have a problem following instructions, and that is why it will be almost impossible to maintain a job when you cannot follow instructions. That is a major problem. Sometimes they may present with confusion, disorientation, and difficulty coordinating their activities. Another common symptom, based on the part of the brain that is affected, they could have loss of bladder or bowel control, and that means they will have incontinence. They have difficulty holding their urine, or even holding their feces. So sometimes they pass urine or defecate on themselves. Also, depending on what part of the brain is affected, they may have hallucinations. They may see things, especially, or also hear voices. And that is, even though that is not a very common symptom, but it happens. Sometimes they may have delusions, thinking that something is happening, or their family, their loved one, their wife, or their spouse, as the case may be, is doing something that they're not supposed to do. Also, they may have problem walking if the blood supply to areas that control muscle movement is affected. That may happen. In vascular dementia, apathy is a very common early symptom compared to Alzheimer's disease, and that is that they lose interest. They just have no interest in the things they used to enjoy before. They also have poor verbal fluency. They cannot speak continuously. They have speech that is broken, and this is because the speech area is affected in the brain. They also have cognitive slowing. Their processing speed is very slow. So they're talking to you, or you ask them a question, it takes time for them to organize their thoughts and come back to where they are. to answer the question. So when you ask a question, it takes time for them to process it, to understand the question you asked and give you a reasonable answer. Very important in vascular dementia is that it occurs in what we call a stepwise progression. And that means today they have just mild memory problem. And in another week or in another few months, 6 months, the memory gets real bad, worse than ever. That is a very common presentation compared to the other types of dementia. So what are the risk factors? What are the things that will make someone have vascular dementia, that will predispose someone to vascular dementia? Number one is high blood pressure, hypertension. Hypertension is a major risk factor in producing vascular dementia. Also, diabetes. Diabetes is a very common factor. Smoking, cigarette smoking, tobacco smoking. Last week we talked about tobacco smoking or tobacco use. This is one of those complications that can arise from use of tobacco. Cigarette smoking is a major risk factor. Another risk factor is obesity, excessive weight. Obesity, excessive fat can predispose to vascular dementia. Another one is high cholesterol. This is one of the reasons why I'm talking about this today, so that people can really understand what is going on here, so that way they can learn on how to prevent this major killer as humans in our lives. Now, also heart disease. If the heart is not beating in rhythm, if there's arrhythmia, a blood clot can form in the heart, what we call an embolus, and when that happens, that embolus could dislodge and go to the brain. When it gets to the brain, it will cause obstruction of blood supply to a particular part of the brain, and that will cause vascular dementia and other vascular problems that could occur. That is another major risk factor. Now, how do you make a diagnosis of vascular dementia as a doctor or as a provider? And family members, it's good to know this so that you can also see some problems or notice a situation before it happens among with your family member or somebody who you interact with all the time. When a patient comes to me, the first and the most very important factor is to get a good history. Get a good history of what's been going on. Look at how long this has happened. What are the other medical problems that they have? Look at the progression. Does this person have slight memory loss, or did they have slight memory loss and shortly or months after it's getting worse, and a few months after it gets worse and worse? So this is a very important history that needs to be taken. That way you can notice the progression if it happened in a stepwise fashion. What are the other symptoms that they have? Do they have physical symptoms, muscle weakness, or problems with other aspects of their body? This will help us to distinguish between Alzheimer's dementia and vascular dementia. You do a physical exam, thorough physical exam. In the physical exam, you check the blood pressure, also check the pulse, listen to the heart. Is the heart beating in rhythm? because if the heart is beating out of rhythm, that will be a pointer to arrhythmia and also to embolus formation, and which will produce a blood clot to the brain. When you do a physical exam, you may notice a lot of changes, weakness in some muscle groups, and that will give you a pointer to what could be going on with this patient. Also, you do blood work. Comprehensive blood exam, comprehensive blood workup will give you a whole lot. When you do that, you check the blood sugar. That will give you an idea if this patient has diabetes or other medical problems. You also check the cholesterol level. If they have high cholesterol, that might predispose to vascular dementia. You also check the liver function test. When we have liver problems, people have a problem with clotting of the blood, and all this could predispose to vascular dementia. It's also noted that people with thyroid problems could have vascular dementia. Another very important testing that we do is to check for syphilis. Syphilis is a sexually transmitted disease. It's been noted that people with secondary or tertiary syphilis goes through stages. The initial infection, you have an ulcer in the area that the infection was contracted, on the penis or the vulva area. That is primary syphilis. If nothing is done, it heals. It gets into a secondary stage, also in tertiary stage, where blood vessels are affected, and this could cause vascular dementia. The other testings we do, important as well, is to do MRI. The MRI will show you if there are damages to the brain. If there were little strokes over the years, you will also see those on MRI or CT scan. But also, it's advisable to do neuropsychological testing. When you do neuropsychological testing, you'll find the extent of damage and the result of those with regards to behavior of the individual when it comes to the effect of the dementia or the trauma or damage to the blood vessels, to the brain. So once a physician does all these testings, checks out also vitamin B12 level in the blood, also folic acid level in the blood, then you tie up all the symptoms, the physical exam, the comprehensive blood workup, and you can make a diagnosis along with the neuropsychological testing. You make a diagnosis of vascular dementia. The real essence, why I'm talking about this, is to inform people on what to see, what to look out for, so that you can appropriately prevent this disease. Now, we're going to quickly take a look at the treatment. The prevention is the most important part, and I'm going to quickly get to it. But let's look at how do you treat a patient with vascular dementia. The mainstay of treatment of vascular dementia is prevention. Prevention of further strokes. You need to prevent any more strokes, any more obstruction of blood supply to the brain from stopping. And how do you do that? You treat the medical problems that could cause shortage of blood supply to the brain. Number one, you treat high blood pressure. If you give adequate blood pressure medications, that will immediately reduce the cutoff of blood supply to the brain. Also, you need to adequately treat the diabetes. Once blood sugar is reduced to a normal level, the chances of obstruction to the blood supply to the brain is also reduced. You also treat the high cholesterol. High cholesterol will form plaques obstructing or narrowing the blood vessels that go to the brain. And this will cause, this is one of the causes of vascular dementia, as we said. So if you reduce the blood sugar, reduce the blood pressure, also reduce the cholesterol level, this will be the mainstay in preventing or reducing worsening of the vascular dementia. Also, if there are behavioral problems like psychosis, if they are having hallucinations or delusions, those are also appropriately treated. Once the psychosis or delusion or paranoia are treated, the person will think appropriately and will be able to accept and tolerate more of the other medications that are given to help with the preventable causes of vascular dementia. It's also advisable to treat depression if they are depressed. Very important is diet control. There's immediate need to reduce fat intake. Reduce fat intake, this will also reduce cholesterol, will reduce other diseases that could arise from excessive fat intake, trans fat, and unsaturated fat. It's been shown that people who take increased fish intake have reduced chances of having vascular dementia. So it's advisable to change your diet more of fish products than red meat, or and change to white meat, more of chicken and fish. Those are very helpful. Another treatment that is important is administration of folic acid, vitamin B6, and also vitamin B12. These three supplements will reduce the risk for stroke. Also, it is advised to take blood thinners like aspirin. Simple aspirin every day will help with reduction in blood clot formation, and that will help with reduction in vascular stroke formation. There are other medications that are used, things like Plavix. All these will help reduce obstruction of blood supply to the brain. So we've talked about the causes of vascular stroke, how to treat it, but before we go to the main thing, that because the treatment of vascular dementia, the main thing is prevention, and that is very vital in this discourse today. So we're going to take a short break, and after that we're going to go to the prevention, the risk factors, how to prevent it, because the main thing is prevention. Once we prevent the causative factors, then there won't be any vascular strokes. But before I go, I just want to recognize Ralph, Jacqueline, John from Sweden, and all others tuning in. Thank you for tuning in today. We're talking about vascular dementia. We are on Facebook Live, Dr. Theo Oswala, MD, and also we are on WBGR Radio. You can call on 301-429-9247, 301-429-9247. I also see Dr. Wagu. Thank you for tuning in. But stay tuned, don't go away. We'll be back shortly after the break.
We're located at 7211 Hanover Parkway, Suite D in Greenbelt, Maryland. Please call us for our promotional package and membership rates. Our number is 202-689-4585. Again, it's 202-689-4585. Please allow us to serve you because your care is essential. And be sure to like us on Facebook at Care Essence Therapeutic Massage.
Hi, it's your friendly Avon representative. Just in time for the holidays. You can order Skin So Soft, all of your makeup
Welcome back after
products,
this one.
toys, clothing, and so much more. But guess what? You do need a representative in order to order Avon. So you can order online and have the products shipped directly to you. All you have to do is log on to www.youravon.com/2blessed. That's www.youravon.com, the number 2blessed. Happy shopping and enjoy your product.
All right, guys, welcome back to Dr. Gilead Show. I'm Dr. Theo Swala, your host. Today we're talking about vascular dementia, and we are on Facebook Live. You can ask a question on our Facebook page, Dr. Theo Oswala MD, or you can call if you're in the area on WBGR Radio 301-429-9247, 301-429-9247. Today we're talking about vascular dementias. All right, so we've looked at all these, but let's look at how to prevent this. That is the most important part of this message. How do you prevent vascular dementia occurring in yourself or in a family member? Now, treatment of risk factors such as hypertension, high cholesterol, diabetes requires special attention. Very important. It is very important that we understand and recognize these major risk factors: high blood pressure, high cholesterol, as well as diabetes. Once these are taken good care of, a lot of people do well. As dementia progresses, more troubling behaviors such as agitation, aggression, wandering, sleep disorders, and sometimes inappropriate sexual behaviors are seen. So, you are here, you're listening right now, you have a family member who used to do very well, remember things, but suddenly they have trouble remembering things. They get easily agitated, aggression, they're getting lost, sleep problems, and becoming sexually inappropriate. Then you need to get them the help they need. They may not even understand what is going on. So, sometimes the decision for placement in institutions or in nursing homes is usually made when these problems become unmanageable, when assistance is necessary in performing activities of daily living. There are sometimes people who have these problems, they can no longer take their bath or feed themselves because they're highly distractible. They can't care for themselves anymore. Sometimes they are home and the spouse or the children can no longer do some of these things for them. Then it's necessary to get them into a facility where they can be appropriately cared for. Let's look at the prevention. Vascular dementia is modifiable and is preventable. It's something that you can prevent, so it's important. Once, like we said, you treat the high blood pressure, you treat the diabetes, you cut out smoking cigarette. Once you cut back smoking, stop smoking cigarette, and also maintain your blood sugar, it is very, very helpful. It's known that Once we're able to do this in midlife, especially when we're young, in our 40s, 30s, when we eat anything we want to eat, drink what we want to drink, smoke what we want to smoke, if we are able to cut back on these behaviors and stay physically active, vascular dementia is very, very preventable. You can prevent it, and once you can take care of these modifiable factors. It is known that the single most important risk factor of vascular dementia is hypertension. Once we prevent hypertension, the chances of having vascular dementia reduces to barest minimum. Also, if we are able to treat things like atrial fibrillation, and that is things that will cause arrhythmias, the heart beating out of rhythm, that will be very, very helpful. Coronary artery disease, heart problems, congestive heart failure, these are all preventable risk factors. Once we can take care of those, the chances of someone developing vascular dementia is very high. So for each and every one of us listening and watching, it's important that you take care of your health, prevent high blood pressure, keep your cholesterol low, stay physically and mentally active, cut back on smoking. If you smoke a lot, actually stop smoking. Reduce your tobacco use, and watch your diet. Physical exercise. These are all very important preventable ways that you can actually prevent vascular dementia. Now, let us look at some of the complications of vascular dementia, and we're going to talk about how caregivers can help out here. Some of the complications are behavioral problems. You can imagine a family member goes out and they don't come back. They're wandering all over the place. I had a patient who got in his car and drove into Washington, D.C., and for 6 hours he was driving around Washington, D.C., could not find his way back home in Maryland. In course of doing that, he got frustrated, he was worried, he had 3 accidents, he hit 3 cars, and he kept going. But one of the people whose cars was hit noticed that something was not really right with this person, and he called the police. When the police caught up with this patient of mine, when they talked to him, they found out that something was not right. He wasn't arrested, but he was taken to Washington Hospital Center, where he was evaluated and kept at the hospital for days. And family was called. Actually, he could not even remember his phone number or the address of his house. All he remembered was his name and his date of birth. And actually, date of birth and name are the last things that people forget. People would always remember their date of birth and their names. Those are the 2 last things that people forget. Once people cannot remember their date of birth or their names, then it is an extreme dementia condition, which is just a matter of time. So, one of the complications is wandering. So they wander around, they get lost. If they are driving, they become a driving risk. They can get into motor vehicle accidents. They could hurt people or hurt themselves, and this is not intentional. It's just that they cannot find their way back home. Other complications are things like delusions. They would think that their spouse is having an affair. Sometimes they also have hallucinations. They hear voices or see things, and they make very poor judgment. Poor judgment in behavior, in doing things, And someone who, you can imagine, I had a patient who was a top member of her church, a leader, a woman leader. But once she had dementia, she became very, very sexually inappropriate. The things she said and the things she did were unbelievable, things completely out of character for her. And they had no option, family had no option than to put her in a facility, a lockdown facility, where they could monitor what she did. Other complications are things like depression. Severe depression could also happen. But also because vascular dementia affects different parts of the brain, they have gait abnormality, and that means the way they walk, they cannot walk straight, so sometimes they sustain falls and hurt themselves. So they have, when you watch them walk, they have difficulty lifting their feet off the ground, so they trip and fall. Also, depending on the part of the brain that is affected, they may have aspiration pneumonia, and that is because the muscles that control fluid from entering the airways will become weak. So when they sleep, or even when they are just resting, saliva and things will go into their airways and they have pneumonia. Sometimes because of weakness and muscle weakness on some parts of the body, they lay in bed too long and they may have ulcers because they're not moving around a lot. One important complication is what we call caregiver burden and stress. In as much as these people who have dementia don't even know what is going on, but someone has to care about them. Someone has to look after them. These people who care about them get burnt out very easily. And that is why this is considered a complication of vascular dementia. And it doesn't only happen in vascular dementia, it also happens in all types of dementia, including Alzheimer's dementia and also dementia that is from Pick's disease, or even the one that is associated with Parkinson's. We're going to take those other times. Now, vascular dementia can also lead to increased psychiatric and medical mobility in the caregiver. The caregiver is stressed out, they themselves become depressed, they become frustrated, and they may develop high blood pressure because they themselves are stressed out and they have problems managing their loved one. One of the things I want to really mention today is for caregivers, for family members, people who are taking care of their loved ones. I want to say that there is nothing wrong in having your loved one go to a facility where they can be looked after. There's nothing wrong with that. For you to have your sanity, it's important that you get to a point where you make the decision that your spouse, your mother, can go to a facility where trained personnel can look after them and give them the appropriate care that they need. This is important for your own mental health care, as well as proper management and proper care of the individual who has the dementia. Because you're not a trained personnel, you may not know how to manage this loved one appropriately. The tendency is to say, oh no, I don't want to put my mother away. You cannot use that word, put them away. No. You put them in a facility where they will be appropriately taken care of. That way, they will have better care, better feeding, because the people who work in these facilities supposedly are trained. And supposedly they know what to do. They know how to manage people with dementia. So I want to give these few guidelines for caregivers. These are the things I call caregiver education, so that if your family member has dementia generally or vascular dementia in particular, you will know how to manage them. You will know how to help them. Before I go to that, I want to just recognize Prince Will from California, also Emeka from right here in Maryland, and also John from Sweden. Thank you for tuning in. Gloria, thank you for tuning in. I see all of you. If you have a question, please feel free to send your questions to our Facebook page, Dr. Theo Oswala, MD. Send a message there or ask a question, or you can also contribute and I can read it out to our audience. Or you can also call on WBGR Radio 301-429-9247 with a question or a contribution, and our listeners and our audience can also benefit from it. So what are the guidelines for caregiver education? How do we help the caregiver? What are the things that caregivers need to know? When a loved one has dementia or vascular dementia, to communicate with them is difficult. So what I advise people is to use short, simple sentences. Don't tell them long stories because they cannot comprehend it. Cognitively, they have difficulty following the long sentence you're about to tell them. Just use short, simple sentences. Dad, brush your teeth. It's simple, it's direct. Dad, drink water. Simple and short. Once you tell a longer story, it is hard for them to follow. They cannot comprehend it. So use short, simple sentences when communicating with people with dementia. That's number one. That is key in communication because they have a problem following or processing what you say. So the longer the sentence, the more difficult it is for them to comprehend. Number two, you have to simplify and create a routine for all self-care tasks. You have to make it simple. Their bathing, their dressing have to be simple. Once it's complicated, it is difficult for them to do. And create a routine so they know that I wake up in the morning, I brush my teeth, I get breakfast. Once they follow that routine, it is difficult to forget. It is difficult not to follow it. Once you break the routine or you take them to a strange place, they are completely disorganized. So you have to make their routine very simple and make it consistent. Don't change too much. Once you change their routine, you throw them off balance. Number three, establish a daily routine for them. Make their daily routine consistent. All activities have to happen about the same time every day. So they know that once I wake up, I brush my teeth, I take a shower, or whichever way, brush your teeth, take a shower, take breakfast. The same table, the same seat, all the time. They have to sit at the same place. So once they know that, after showering, brushing their teeth, they go straight to the same seat, the same place, and you give them their meal. They also know that after my food, I take medications. So once you set that up, they follow the routine. Things like recreation. After meal, they take their medication, they go sit down, and they may play a game with someone else, or they can do some exercises, physical exercise, or they can take a walk with somebody. So once that is set up, they follow it routinely. And their sleep time has to be regulated. You have to regulate their sleep time. They wake up, they do all the things. By 1 p.m. after lunch, they go to take a little sleep. Once that is done, they know that that's their daily routine. They cannot change from it. Once you follow a routine, it's easy to manage. Now, because they sometimes get disoriented, they could get lost, so you have to keep them oriented. And that is, you use signs and pictures. On the door, in their bedroom, you write clearly, Mr. John Doe, bedroom. They can read. So even if they get lost on the hallway, they walk in, they're going to see their name on the door. Also, you can put their picture on that door. They know that, what, this is my bedroom. They will go in, they have their bed, and they lay down on their bed. It's also good to display big clocks so they can know what time it is. That way, they can always look at the time, and once they know that at 1 p.m. I need to sleep, they look at their time, it's 1 p.m., they go lay down on their bed if they can find their room. So once you display their name and their picture on their door, they will always follow it. You can put big calendars, and every morning you mark the date of that particular day. Today is July 6th. You move the calendar to July 6th. So once they look at the calendar, they say, okay, it's July 6th. They hold on to that for that day. They cannot forget. It makes them feel better. Also, when people have dementia, they don't remember family members anymore. So from early part of dementia, they should have visible, well-developed pictures of their family members. That way, they do not forget their spouse, their wife, or their husband, as the case may be. So in their room, put well-developed, colorful pictures of their loved ones, their family members. That way, they look at it, they see the photos of their family members, and when you come to their room, ask, who is this? Oh, that is my wife. They may not remember when they got married. They may not remember how long they've been married, but they know that that is their spouse, that is their husband, or that is their wife. It is also good to list their daily activities. So in their room or in a visible place in the house, if they are still at home, write visibly, very loud, very large, what their daily activities are, and put the time. Once they look at it, they will see that at 1 o'clock is lunchtime. They go look at it, they know the dining table is right there, and they are maintaining the same seat all the time. So at 1 o'clock, while he's walking on the hallway, pacing whichever way, they will see it, they will read it, and they will go straight to the dining table, and they will sit on their particular seat. That is exactly how you can manage it easily. But once you break the routine, it is very difficult for them to follow. Also, for caregivers, it is very difficult to control the inappropriate behaviors of people with vascular dementia. So, confronting them does not help the situation. Getting angry does not help the situation. What do? You use distractions to manage or control their irritable or socially inappropriate behaviors. Your husband, who has dementia, actually I had a patient who the wife stepped out to just go to the store to buy something. By the time she came back, the husband had opened the door, and a lady that was passing by invited her into his house. And when the lady asked her, no, I live here alone, I don't have a wife, And the lady came into the house, and when the wife got back home, she was so shocked. This is her husband who never did that type of a thing. When they're walking, they go to the stores or they go to the stores. She would tap a lady behind on her butt. How can you be walking with your wife and you're grabbing another lady's behind? Or saying things that are completely inappropriate. So for spouses and caregivers, getting angry does not make a difference. Confronting them does not make a difference because they actually do not understand what they're doing. Once you say it, you're angry, the next minute they do exactly the same thing. So confrontation does not help. Rather, what I teach my caregivers is to use distractions. So if they like to look at videos on the phone, or you have discussions with them about things that are interesting to them, talk about grandchildren, talk about going to the store to get something that they like. Those are the things that will keep them focused on what you're doing and away from people and places where they could carry out socially inappropriate behaviors. Now, people with vascular dementia can act out. They could get very irritable, and when they get irritable, they can really do things that are out of character, things that even you will say, well, what is going on with my wife? She is never like this. She doesn't act this way. Once you notice that, the best thing to do is to pull them behind, let them focus on things that they enjoy doing. Let them focus on things that they are happier talking about. Show them pictures of grandchildren, pictures of, or for example, wedding pictures, or pictures when you went to Hawaii, or pictures when you went out of town, places that you've been, things that will keep their attention to that. And once that happens, the irritability and socially inappropriate behaviors are taken care of. So caregivers can easily get burnt out. So it's always good not to get angry yourself, but sometimes you may need to seek help. Caregivers have groups for caregivers where you can go and meet with other caregivers. So today we've talked about vascular dementia, the dementia that is mostly caused by obstruction of blood vessels to the brain, which could be a gradual thing, slow, progressive, tiny obstructions that cause brain damage. And gradually they develop stepwise loss of memory, cognitive behavior, and other socially inappropriate behavior. This is a very difficult illness to treat, and it's known that people with vascular dementia have 50% of life expectancy. So it shortens their lifespan, but the most important thing is to look at the modifiable risk factors. Treat high blood pressure, treat cholesterol, treat diabetes, stay physically active, eat healthy, and keep up with your doctor's appointments. I want to say thank you for tuning in today, and everyone who tuned in from Sweden, Maryland, Los Angeles, California, Nigeria, South Africa, and UK. Thank you for tuning in today. Stay tuned again next week when we talk about another type of dementia. Same time, Thursday, 1 p.m. Eastern U.S. Standard Time. Thank you for tuning in today. I'm Dr. Theo Oswala. I'm a psychiatrist, your host. You can call me on my office, 301-577-9111, 301-577-9111. If you have a patient or a loved one, you want to get an assessment or an evaluation, call 301-577-9111, or you can send us a message on our Facebook page, Dr. Theo Oswala, MD, and we'll reach back to you. Thank you for tuning in today. I'll see you again same time next week at 1 p.m. Thank you.